Hi everybody and welcome to my vlog. It seems like I haven't been talking to you for ages, but I don't know, I've been away, so maybe that's why. So anyway, this week I'm going to do something called TMJ disorder or dysfunction. And the reason I'm going to do that is simple. Somebody very close to me has been suffering, and I see patients with this all of the time, and we quite often, really as a GP, don't have many answers for it other than that it usually gets better in time and have some painkillers. But I'll go over the treatments later. And I have found a magic treatment for TMJ. Now it may not work for all TMJ, but it certainly has worked for the person close to me. And we sorted it out within a week. And so you'll have to go all the way to the end to find that treatment, but it is in here. But before we start, what is TMJ disorder? Well, it's temporomandibular disorder. It affects the movement of the jaw, it causes pain, and it's not usually serious, as I said, but it can be very distressing and disturbing. So what's the TMJ? It's the temporomandibular joint. So the joint is up here, and it's kind of a sliding hinge, and it's where the jawbone, the mandible, fixes onto the skull. And obviously if you do that, if you put your finger just in front of the ear and move your jaw around, you will feel that joint moving from side to side. So TMJ syndrome is when something goes wrong with that joint. So what are the symptoms of TMJ disorder? Well, you get pain around the jaw, the ear, the temple, and it really can be debilitating pain. It interferes with eating, and the person who I treated this week was actually barely eating because it was too painful. You can get a clicking, a popping or a grinding when the jaw moves. Difficulty opening the mouth to any degree at all. So the person I was treating literally could just sort of go, and it just wasn't enough. It wasn't enough to get pressure when eating, and it was painful. You get headaches around the temples. The jaw can lock, so you can't move it at all. Chewing anything is painful, and it can even interfere with sleep because obviously you're lying on it and the pain continues when you're trying to sleep. So what causes it? Well, genetics can play a part, and that's obviously to do with bone structure and teeth and everything else. Arthritis, and that could be any kind of arthritis, rheumatoid, osteoarthritis. Any kind of jaw injury that you've had in the past, and clenching or grinding your teeth, otherwise known as bruxism. So what are the risk factors for getting it? Because it's quite common, we see it in GP quite a lot. So arthritis, rheumatoid disease, osteoarthritis, as I said, a previous jaw injury, long-term grinding and clenching. So if you know that you do that, it does put you at risk of getting it. And any kind of connective tissue disease can also put you at risk of it. So for example, Ehlers-Danlos syndrome, EDS. Didn't say that very well, did I? Another one of those words, or those combination words. So how does it get diagnosed? Well, you'll go to see me, your GP, and I'll take a history covering off all of those things. When did you last see a dentist? Do you grind your teeth? Have you had a jaw injury? Do you have any rheumatoid disease, arthritis, connective tissue diseases? All of those questions to cover off all of the risks. Are you anxious? Do you have anxiety? Is there something going on in life at the moment that's bothering you? Because it can be connected to anxiety, because often when people are anxious, they grind their teeth or clench. And I certainly do, so that's something I get when I'm anxious. But instead of getting pain here, I actually get pain around here where I tense my muscles. So, you may not even feel anxious to be doing that. So then there are two pathways. So we can give you painkillers, see what happens, and we should advise you to see a dentist so that the dentist can check what's going on, have a look at your teeth, because they would be able to see signs of clenching even if you think you're not doing it. Possibly do a dental x-ray to have a look at the jaw and the joint. And then later on, if all of the treatments that we have at our fingertips in primary care aren't working, we could refer you on where you'd probably have a CT scan, an MRI scan to look at the bones and the joint and all of the connective tissues, the cartilage between the joint and the ligaments around it. And you may even undergo something called TMJ arthroscopy, where a small tube is inserted into the joint and a tiny camera is put in to have a look at what's going on within the joint. Very similar to what we do with knees, for example. We do knee arthroscopies where we go in, have a look, and sometimes we can actually treat at the same time. So, having got the diagnosis of TMJ dysfunction, there are various different arms of treatments. There's, as usual, lifestyle, medication, physical treatments, surgical treatments, alternative therapies, and my special treatment, which we're going to come to. So, lifestyle. And I guess that's really just about being aware of any tension-related habits, so clenching your teeth, grinding your teeth. Even, some people repetitively chew pencils or pens. That kind of thing can actually put pressure on the joints. Stretching and massaging, a dentist or a specialist therapist can give you specialist exercises to do to open up the jaw, strengthen the muscles and stretch the muscles around it. You should avoid overusing the jaw muscles, so stick to soft food, cut your food into very small pieces, don't have very claggy or sticky food, don't chew gum. You might be tempted to chew gum as a way of exercising, but actually it can make it worse. And using heat or ice packs to the area just to help with the pain. So those are the lifestyle ways of approaching it. Then of course there's medication, and this is probably what we do in primary care. So pain relief, and the anti-inflammatories are where we would go to. So you can try ibuprofen over the counter. If that's helping but not enough, or it's not helping at all, you see your GP and they can prescribe something like naproxen or diclofenac, which are slightly stronger anti-inflammatories in the same class as ibuprofen. Tricyclic antidepressants like amitriptyline. Now, we don't use them in big enough doses for it to be an antidepressant, so don't worry. But literally as smaller doses as 10 or 20 milligrams, often taken at night because they help you sleep, can actually help with the pain and ease the sleep. So you get a kind of double effect from that. And then muscle relaxants that would actually relax some of the muscles around the area to try and help. And we'll come back to relaxing the muscles later. So then physical treatments, and by that I mean therapies in the main. So physical therapies, but also mouth guards or oral splints. Now this is really common as a treatment, and dentists often do this. So when people are grinding or clenching, they actually make up a mouth guard that's fitted to your teeth and you wear it at night. They're horrible. People don't like them. They quite often don't use them, but they spend a lot of money getting them. So it's a very common treatment, and it's one that I often see fail. Physical therapies like exercises that I spoke about earlier, ultrasound therapy that physiotherapists use to just help all the muscles and ligaments in the area, and moist heat and ice. And then counselling and CBT. And why would I recommend psychological therapies, I can hear you saying? Well, basically they're aimed at the behaviours and helping you stop them or not do them in response to triggers. So if anxiety is one of the underlying causes, then CBT can help you unpick that anxiety and also stop the habits like chewing pens, clenching, grinding. So it is a treatment that's worthwhile. It is hard to do, as you know, I've spoken about it before, but often really effective. Then there's surgery. Now, when we're talking about surgery, we're talking about if you've got TMJ dysfunction that hasn't responded to any other treatment for more than 6 months, if you've got a limitation or difficulty in opening your mouth, if you've got a persistent inability to eat a normal diet, so you're losing weight, and I certainly saw this with my close relative, if you've got known rheumatoid arthritis, or if you've got recurrent dislocation of the jaw, and believe it or not, you can dislocate your jaw, and this is especially true in diseases like EDS, Ehlers-Danlos syndrome, or if you've got other associated symptoms with those syndromes, then we would refer you on to see a surgeon, probably be a maxillofacial surgeon or even orthopaedics, but probably maxillofacial. Surgical treatments are really varied and they change from country to country, so from the States to here, but they can include things like steroid injections into the joint just to calm down the inflammation. Arthrocentesis, which is where you put a needle into the joint and you flush it through with fluid, saline, to take away any debris or any inflammatory cells and byproducts that are there to be washed away, and hopefully cleaning out the joint that way will help. TMJ arthroscopy we've already spoken about, and that's where we go in with a camera and have a look. But at the same time, you can actually pass tiny surgical instruments through the same cannula and do minor surgery inside the joint, clearing away any debris, anything that's broken or torn on the ligaments or the cartilage. A meniscoplasty or a meniscotomy, and that's the joint has got a piece of cartilage between it. All bones at a joint always have cartilage between them, and basically this means to either put it back in place if it's slipped out like a slip disc, trim it back if it's raggedy or torn and it's catching and that's what's causing it, or take it out altogether if it's really beyond repair. There's also something called a modified condylotomy, and that's surgery to the actual jaw itself rather than the joint, which sometimes prevents it from locking, takes away pain and just makes it more mobile. But I don't think that's something we do very often. And then there's open joint surgery, where you look at the joint, you open it, so rather than do it through a tiny cannula and like keyhole, you actually do an incision, open up the joint, have a look at it, repair anything or replace anything that needs replacing. And then there are the alternative therapies, so relaxation techniques, which can really help if it's anxiety that's underpinning it, mindfulness, meditation, breathing exercise, to just calm everything down and stop the tensing that's causing the problem. Acupuncture, some people have seen that work, and I'm a great fan of acupuncture, so I do think that's a great idea. And finally, in the alternatives, there's biofeedback, which looks like quite an important tool in helping people overcome this tightening of the muscle as a response to stress, because it's that tightening of the muscle as a response to stress which then causes facial pain, because muscles that are overstressed all of the time start to hurt, and that is the mechanism of the pain in TMJ dysfunction. So biofeedback utilises small electrodes which are attached to the muscles and a screen, often done in someone's office, obviously a therapist's office, and patients get to learn how they're reacting to things, how those muscles are reacting and stressing, and then learn to deregulate that so that it actually reduces the amount of strength and tightening in those muscles and therefore reduces the pain. So that's one other alternative treatment for TMJ disorder. Now, to my treatment. I say my treatment, obviously people are doing this, but it just doesn't seem to be that well known, and that's why I wanted to do this vlog. So I don't know if you know, but I've got an aesthetics clinic where I use botulism toxin, brand name Botox, fillers and all sorts of other things to make women happier with their, and men, with their wrinkles and their faces and their lips and their cheeks. So I often use Botox to actually help people who are clenching their teeth. And that's really common, and it works really, really well. So instead of having to wear a horrible mouth guard at night, they actually just have some botulism toxin injections into the masseter muscles and they stop grinding. When I first started working as a doctor, I was so stressed, I started grinding for the first time ever. So I had botulism toxin injected into my masseters, and it sorted it out and it never came back. It allowed me to get over that period of being a newly qualified doctor that was fairly stressful. So I think it's really important to get in early and break the habit of over-clenching these muscles, and it works really well when anxiety, grinding, stress, clenching are at the base of the problem. You've got an over-tensing of the masseter muscle, which is this great big muscle here, but you can always feel the point of maximal tension. So when you put your fingers here and you ask the patient to clench their teeth, you can feel where the muscle is contracting its most, and that's where the injections go. The rest of the muscle carries on working perfectly normally, but that really tight point there is relaxed because botulism toxin paralyses muscle and stops it temporarily from doing that. It's a really simple procedure. It takes 5 minutes. It needs to be done by somebody like me who knows their facial anatomy, who knows what they're doing, because it does what it says on the tin and paralyses muscle, but used in the right way, in the right muscle, avoiding the parotid gland, which is up here. It's a brilliant treatment, and it's a very safe treatment. We've been using Botox in the NHS for years, 40 years, on all sorts of medical things, and I might do a vlog about that actually, because it's actually a really, really useful drug with very few side effects. There's no downtime. You have a few tiny little holes here from a very, very fine needle. It's not really that painful at all, and you just go about your business afterwards. It starts working within 2 to 3 days, and you've got your maximum effect within 2 to 3 weeks. And somebody quite close to me, as you know, that's what prompted me to do this video, when they had it done, their actual problem was sorted within a week. They were in agony, they weren't eating, they were losing weight, and within a week it was gone, completely sorted. And I just got a text to say, I've had my first pain-free night in 4 months. And that's brilliant, that's exactly what I wanted to hear. So, I don't think it's readily available on the NHS. I've certainly not seen anyone have it on the NHS. That doesn't mean you couldn't ask for someone to do a funding request for it, because we do use Botox in the NHS a lot. It's certainly available in some private clinics, but you need, as I said, somebody who's qualified and knows what they're doing. It's certainly available in mine. And as I've said, TMJ dysfunction is really common. We see it a lot. It's often associated with anxiety, grinding of teeth, clenching of teeth, stress, and habit also. And it is kind of a self-fulfilling prophecy. You know, you start stressing about it because it's hurting so much, then you make it worse because you clench those muscles even tighter. And along the way, if you're clenching or grinding, you can crack your teeth, and dentistry is expensive. And you don't want cracked teeth, why would you? So, you know, it's really important to sort it out as quickly as possible. So not only does botulism toxin or Botox sort it out really quickly, it also prevents you from grinding your teeth, as I found out 10 years ago when I qualified as a doctor. As I've said, TMJ dysfunction does usually resolve on its own, but it can take up to 6 months. There are lots of treatments aimed at relieving pain and distracting you from that pain. Botulism toxin or Botox is underused and simple. That's my personal opinion. Surgeons deal with TMJ after GPs can no longer help the patient, and surgeons tend to do surgery, and surgery is a big thing. So why go to surgery if you don't have to? There isn't much downside, it's worth a try, and it may just work. So anyway, I'm going to put a really useful document that I found, written by the Royal College of Surgeons, which is a pathway about TMJ dysfunction, and it shows you how you should be dealt with. It's actually aimed at doctors, but I really thought it was a useful document. It's actually got some really good links in it to other websites that can help with all of the different aspects of TMJ dysfunction. So I'll put a link to that in the comments. If you've got any questions about it, please ask them. I love getting your questions and answering them. And I will see you again shortly. And if you've got any topics that you want me to cover, please post them as well, and I'll always happily do them for you, because I learn. Every time I do a new topic, I learn something, so it's brilliant for me. So thank you for watching. I hope the weather's not too bad over the next few weeks before I see you again. Winter is here, which makes me a bit sad, and Christmas is coming. So, see you soon, and thanks ever so much for all of your support and for watching. Take care.